Good afternoon, all. Earlier today, I announced a mandatory stay-at-home order for all residents in the city of St. Louis, effective Monday evening, March 23rd, in order to prevent further spread of COVID-19. St. Louis County made the same announcement earlier today, and other regional leaders are considering this decision. It was an extremely difficult decision that we did not take lightly. I am worried about people's health, and I am worried about people's finances. I wish we did not have to do this. Over the past several months, and even more intensely the last couple of weeks, we have been meeting with and being advised by our public health director, Dr. Fred Eccles, who's here with me, and the three hospital systems, BJC, SSM, and Mercy. Their guidance, their advice on this global health pandemic is clear. This situation will only get worse, much worse, if we don't act right now and enact this order and continue to build upon the orders that we have already issued. This is an unprecedented response in the region. Understandably, this action has led to a lot of questions from the public and from the press. So first, I'd like to take a second and explain why we are making this move. After that, we'll talk about how this will be implemented, and then we'll take questions. First, the why. We now have evidence of community spread, community transmission of the COVID-19 virus in the St. Louis region. That means that we have reached the point where new infections are not related to travel, or not just related to travel, but they are also being transmitted person to person, and that is happening locally. We're also seeing a number of positive COVID-19 cases in Missouri continue to climb. On Monday, just 6 days ago, the number of cases in Missouri was 8. Yesterday, the number of cases in Missouri is 73. We don't have the numbers for today yet, but assuredly it is more. We must limit unnecessary social mixing and interactions. We must do that so that we can safeguard our local healthcare systems, so that we can safeguard healthcare workers, and most importantly, so that we can prevent additional people in our community from getting sick and flatten this curve and slow the increase. So that brings us to how. How do we enact this order? As I mentioned a minute ago, this stay-at-home order will go into effect at 6 p.m. Monday evening, and it'll remain in effect for 30 days. 30 days covers 2 incubation periods for the COVID-19 virus. That's the reason for that 30-day initial period. The order requires all residents to stay at home as much as possible and to leave to pick up takeout food, carry out food from your local restaurants, go to the store, grocery store, go to the pharmacy, get medicine, get supplies for your family, pets, go to the doctor. Go outdoors for a walk. Maintain 6 feet of distance between one another. Work in your yard, garden, that's fine. Maintains a distance there if you're with other folks. And go to work if you are not already working from home, and if your business is one of the businesses that is accepted from this order. You can still go to the gas station, the laundromat, the bank, hardware store, your local parks, all the while observing social distancing. Don't panic, don't be alarmed, but do take this seriously. I'm encouraged to report that there is no shortage of food, either in this country or in this region. We have a good local food supply, and the food supply chain is strong. I want to take a minute to thank the men and women who are working long hours in those grocery stores, restocking the shelves, unloading the trucks, helping you to check out, because they're working a lot these days. Keep your distance in the grocery stores. One of the grocery store chains has actually created a sign which advises you to stay 6 feet apart. Our goal here is to keep the economy running as much as we can and not to further impact the hardworking people of our city. But we must severely limit these unnecessary social interactions. This order, signed by Dr. Eccles, head of our health department, is not a suggestion, it's not a recommendation, it's an order. I know the people of St. Louis. They are good people. They will follow this order if we advise them. I think that's one of the things that we have here in our community that is very special. We have a group of people that will understand this order and will follow this order because they don't want to get sick themselves. They don't want to bring it home to a family member, and they want to help us flatten the curve and reduce the spread of the COVID-19 virus. It's very challenging. It's a very uncertain time, but I truly believe this action is necessary based on the advice from Dr. Eccles, BJC, SSM, and Mercy. I want to turn this over to Dr. Eccles. He and I are both happy to take questions from you. We do have the order here. I believe that each of you have gotten a copy of this order, and of course it's online, or it will be if it isn't quite yet. We tried to write it in plain English, plain language, so that it's understandable, because a written order that's got a lot of legalese and a lot of that stuff in it, it's not helpful to people. And what we're trying to do here is communicate, and I appreciate you all being here to help us project that message. So,
All right, questions?
questions?
Justina?
So I know in this order, there is no, does not include fitness gym, fitness centers, gyms, massage parlors, nail salons, barbershops. They are ordered now to close on Monday. What is enforced, or what's the plan to make sure they are following by the rules?
So, as I said, the people of St. Louis and these businesses, they're going to try to follow these rules. If there's an issue and you think someone isn't following the rules, of course you can report that through 622-4800, which is our normal Citizen Service Bureau line, and the health department will follow up on that. But these rules are not intended to be punitive. This is intended to be helpful. This isn't something that is unnecessary. So I think these folks, we have to get the message out to them, and we'll do that electronically, and you'll do that with the media, and we're taking calls, and we have lots of text messages, because there are so many questions about this. And so we just all need to continue with the messaging, and I expect people will comply. There can be penalties, yes. I think it's a Class A misdemeanor.
Right, but more importantly, we're really emphasizing the importance that this response is a community-wide effort. The health department, we have recommendations and regulations, but this has to be a community-level response. So Those simple preventive measures that we keep emphasizing day in and day out, it's really important that people in the community adhere to those recommendations. Staying home if you're ill, covering your mouth if you cough to prevent other people from being exposed, and those other simple measures that people can take to reduce their risk for becoming infected, as well as reduce the risk to others if an individual is already infected. So again, this is a community level response. We need everyone to be accountable. Hold yourself accountable, hold your neighbors, your friends, your family members accountable, because we all have a part to play in this.
Those who have pets, if some sort of emergency with your cat or your dog, and you need to take the animal to an animal hospital, what about that?
Yes, all medical facilities, that includes for animals too, remain open. They are accepted, of course, anything related to that. Yeah, walk your dog, pet your cat.
Mayor, you were asking for federal assistance for our hospitality workers earlier this week. Is there any update with that or any progress?
So I spoke just this afternoon with Congressman Clay. You all know what's going on in Congress now. They're debating a bill right now, which the last time I saw could be $2 trillion. That's direct aid to people, but it's also aid to businesses. Hopefully that will pass soon. Congressman Clay assured me that he's working hard on our behalf. City of St. Louis is in his district. He also has a good part of St. Louis County. And so he's working hard on our behalf. So is Senator Blunt. I spoke with him 2 mornings ago. This is one of those things that Congress has to come through on, because it can't be left up to local government, although we'll certainly do our part.
Dr. Eccles, could you address hospital capacity? As we see in some other cities where the numbers are really spiking high, concern about hospital capacity, what sort of planning is being done here in St. Louis to increase hospital capacity? Are there any plans for any tent hospitals or turning some sort of vacant building into some sort of medical facility?
So we're having discussions with the health systems almost daily to talk about, revisit and review the capacity of the health system. And one way to protect the health system is by implementing community mitigation strategies such as this. And not only does it protect the health system, but also protect the public health infrastructure that's in place for the region. And so this is really important as we move forward to really make sure we're constantly reevaluating what's happening in our community, being in constant dialogue with our health system partners or hospital partners to make sure that we are bringing the resources that we need to provide services to individuals that need them.
No concrete plans on a tent hospital yet?
Not yet.
Have you been seeing younger people getting sick just like in New York? I know it's, for the younger crowd, you're saying they're not taking it as seriously, but I'm assuming just like in New York and other locations, we're seeing younger people get sick.
Right, so that's one of the challenges. So the initial messages that went out regarding COVID-19 was inaccurate. So just like influenza and the common cold, anyone that's exposed is at risk for becoming infected. And so young people are not exempt. Again, young people are not exempt. They can become infected just like the older individuals. And so it's important, as I mentioned before, that everyone play their role in implementing those simple measures to prevent the spread of COVID-19 in our community.
Anyone else? How about liquor stores? Is that fall under the heading of the grocery stores?
Falls into the heading of food and beverage. Most liquor stores sell some food, and yes.
Just one more, thinking about the barber shops and also the salon, if it goes on for a while, it's kind of become a little uncomfortable.
I'm worried about that myself, Jim.
So I think we decided, we'll all.
It's the intimacy of exposure for that salon worker with 10 customers a day, 6 customers a day, and if they were to become infected, the interchange. It's just, you're not able to socially distance while you're getting your hair cut.
So we'll all just have long hair.
Or bad haircuts if we do it ourselves.
One last question on the homeless. What do you say about efforts to address the homeless at this time?
So we are working intensely on that. We have some additional beds that are coming online. Tuesday, I believe, is the day. We also are coordinating with St. Louis County. We've been in conversations all day today. We have hand washing stations around town. We have several porta potties because some of the places, that had previously been available are not. We are placing those around various areas in the city. I mean, Our goal here is not to make it so they stay on the street. Our goal is to get everyone into housing, get everyone into shelter. Because, you can't get your life back together from the street. But we have to strike a balance, try to get people into shelter, provide some minimums for people that we are unable to persuade to go into shelter.
Thanks, guys. Appreciate it.
Thank you all.
Everyone got a copy